It's 11:30, and what we're going to do is move on. Oh, well. Okay, and what we're going to do then is move on to session one for a half hour till noon. So is there a logical break point in the presentations that will work? Okay, all right, great. Then let me turn things back to you.
Don't forget to introduce yourself.
Well, I think so. Obviously, there's several of us up here. So the idea for the format for these sessions is that we're going to have speakers. So in this session, it's going to be Andrew Kraft and I speaking. But then we've tried to populate our panel with folks who've really been involved in developing the methods that we're talking about. So Beth Radke, an epidemiologist, Michelle Taylor, who's really been working a lot of the tools for literature identification. And then we have April Luke, an animal toxicologist. And so what we're going to do is first talk about, let's see, oops, wrong. Okay, close that. Okay, where am I at?
The big fat green one.
The big one in the middle. Okay. To sort of help anchor us, let's just put our, I guess, required definition of systematic review as the first slide in the section. A structured process for a transparent literature review. So a commonly used definition comes from an Institute of Medicine report. This was a definition that was used in the 2014 report. So it's a scientific investigation that focuses on a specific question and uses explicit, pre-specified scientific methods to identify, select, assess, and summarize the findings of similar but separate studies. In the 2014 NAS report, there's a schematic that includes sort of the phases of an assessment, starting off with scoping and problem formulation, to actually doing the assessment, collecting the evidence, summarizing the quality of individual pieces of the evidence, looking across evidence, and then using that to inform hazard conclusions, and then subsequently deriving toxicity values. So in that report, the systematic review is really sort of defined as more sort of developing the protocol and evidence integration. Within IRIS, in our talk today, you're going to sort of see that for us, it's really more of an expansion. So we would sort of include problem formulation scoping as part of systematic review, because that's really where you begin to identify the question, hence the most pertinent evidence to address that question. And then we also would consider sort of hazard identification as part of systematic review, because you'll see that we use structured frameworks to help articulate our confidence in these conclusions, and that's increasingly part of the package of systematic review. So what we're going to do now is this session has two parts. One is scoping, problem formulation, and protocol development, and then I'm going to speak to this part. And then there may be a natural break in there, depending on time, before we turn it over to Andrew to talk more about literature identification. So the structure of some of these slides, obviously in the 2014 report, there are many recommendations. So what we've tried to do is focus on the high priority box 8.1 recommendations in the back of the report. And so what we're going to do in this session is talk a little bit about IRIS systematic review documents, new documents that we think are responsive to a couple of these box 8 recommendations. So obviously we're not going to put the whole quote here, but part of that box 8 sort of identified the need to complete documents such as the draft handbook that provides detailed guidance for developing assessments. And also the EPA should include protocols for all systematic reviews. So at the chemical specific level. So what I want to do in my session is orient you toward 3 documents that are really more systematic review related. The IRIS handbook, and I'm going to talk about each of these individually. The IRIS handbook, which is really more of a reference internal document, assessment plans that outline the what we're proposing to do, and then protocols that outline how. So the IRIS handbook, I think many people in the room have heard about the IRIS handbook. Again, it's really sort of a reference document that talks about approaches and considerations for doing systematic review. It's really aimed at the level of EPA staff and contractors. So it would have guidance on when you're thinking about developing a literature strategy, keep these factors in mind. You know, this is how you assess the quality of your literature search strategy. It might have timelines for internal review. So again, it's aimed at the level of EPA staff and contractors. It's currently being updated to reflect agency input. We've shared it with the agency. Also, some of these evolving practices for implementing systematic review that have happened over the past year. And also public comments that we anticipate receiving on chemical-specific protocols. So one that was just posted recently is a chloroform protocol, and I think that on the background materials for this meeting, there's a link to that. So we anticipate that we'll be updating the handbook and then probably circulating it, well, we will be circulating it within the agency for more comments, probably doing a debriefing with other agencies, and then our intent is to post it for the public. It would be evergreen to sort of reflect future advances. But I do think one of the things that we want to do in this session is kind of pivot. I think people have been sort of asking, where's the IRIS handbook? Where's the IRIS handbook? But you need to recognize that if you're talking about sort of the method document of record for a chemical specific assessment, that's not the handbook. That's the protocols, which we'll explain later. So I think the IRIS handbook, people have been asking about it, we want to get it out there, but recognize that its release should not be a bottleneck for us to be able to convey the transparency on specific chemical assessments. Okay, so the two documents that are now really more chemical specific would be IRIS assessment plans and protocols. So the assessment plan is this red box that really covers the scoping and problem formulation activities. And the result of that is an assessment plan that says what the assessment will cover. What are the agency needs? It gives a bit of, well, I'll explain a little bit more about the assessment plan. I have a separate slide for that. But it's really the what. And then the idea is to get public feedback on the what, incorporate that feedback into the next document that we would share with the public, the protocol that says the how. So there's two documents that go out for two separate rounds of public engagement. The assessment plans and the protocols would outline any proposed modularity. Modularity is, what, Dave, when you asked your comment about what the portfolio looks like, and I said in some cases we might not do both a reference concentration and a reference dose. So that would be an example of modularity. So that kind of, those thoughts would be embedded within the assessment plan and the protocols. We have templates of assessment plans and protocols that help facilitate consistency across the program. So the IRIS program is a team matrix. It's actually implemented by different divisions within NCEA, and it's implemented by people who are geographically in different places. So as we do systematic review, recognizing that we're trying to implement it across a team matrix. So obviously templates help. So in the content, we've talked a little bit about the IRIS 7-step process, but it includes in step 1, you have scoping and problem formulation, actual draft development. In step 2, you have the agency review. In 3, interagency science consultation. 4, public comment, external peer review. And then, as we've discussed earlier, you have revisions to the assessment based on all those inputs, and then finalization. So the IRIS assessment plan is really at the very, very earliest stages, would be when we're seeking input again on the question. So the idea is that we would have this document, it would be released for a 30-day public comment period. There would be a public science meeting to go along with that public comment period. We're envisioning that these public science meetings might be web-based. In part, as you can imagine, we don't necessarily have the resources to have face-to-face meetings on every assessment plan. Again, we would consider the feedback that we get on the assessment plan and then release the protocol very early in the process. So ideally within like a few months of having the assessment plan out there. And this would talk more about the methods. So the IRS assessment plan in terms of contents, it would include information about the background and the agency need, give some context for the exposures, not obviously a review of all the exposures, but enough to understand the context of the assessment plan. It would outline the objectives and specific aims, key areas of scientific complexity. It also include a draft PICO, which will make sense to those of you who know systematic review. But a PICO statement is this population exposure comparator and outcomes statement that really frames the kind of evidence that you think is most pertinent to address the question. So we're using PICO. It's an extrapolation from sort of more the clinical epidemiology roots of systematic review. Population typically has been applied to talk about human populations. In environmental health, it's often where we would describe the evidence stream. Are we looking at human evidence, animal evidence, more mechanistic evidence? So it's really key, again, because it outlines the kind of evidence that you're proposing to collect to address the specific aims. The IAP undergoes internal review. So again, we mentioned that one of the ways as part of ensuring the utility of these assessments and the quality is to have this very active back and forth engagement within the agency about what we're proposing to do. And so the IRS assessment plan is just as a written document, it helps crystallize those conversations. And again, it would be released for a 30-day public comment period and then a public science discussion. So in terms of examples, there were 3 that were released in September of 2017, chloroform, ethylbenzene, and nitrate and nitrite, and then just recently uranium was released. So these are just some screenshots from an IRS assessment plan. This is uranium. Obviously, I'm not going to expect you to read this, but this would be sort of a table that outlines the agency need. And I don't know if you can read that. In this case, there's columns for oral and inhalation values, and for uranium, only oral was desired. And it would talk about sort of the use, the specific aims, a PICO statement. So this, again, would outline the evidence that we think is most pertinent. For uranium, because we are aware generally of the uranium evidence base, there's been a recent ATSDR assessment. So you'll see in here that there's a call out that because we think that we have enough sort of, quote, traditional evidence, animal, bioassay, human, that we don't envision for this assessment that we have to look at every individual mechanistic study. We can probably rely on secondary sources. So some of this in terms of how do we use the mechanistic information, when we can make those determinants up front, we try to signal that in these assessment documents. And then key scientific areas. IAPs can also include literature surveys. So these are broad surveys of the literature, typically broken down by evidence stream. So for example, human, animal, more in vitro, other kind of mechanistic, often by health outcome. So these surveys help us assess the extent and nature of the evidence. So you can imagine that if you do this kind of survey and you find you have a lot of epidemiological evidence, a lot of animal bioassay evidence, and a lot of mechanistic information, then you think you can probably put more of a premium on the human and the animal. And then in that case, mechanistic information might be more supportive or very targeted. You could find the flip. You could find that you have no epi, very little animal bioassay, and the only thing you have is mechanistic. And that's obviously going to sort of trigger a different kind of expertise that you bring to the table and approach the assessment. So these surveys, they can be based on in this case, it's based on sort of looking across ATSCR and IARC documents to try to understand the extent of the evidence in each of these cells. They can be based on manual screening. They can be based on some of the specialized software applications that you're going to be hearing about today. Protocols are, again, how the assessment will be conducted. So the protocol would include everything from approaches for searching the literature, all the way up to dose value derivation. So sort of beyond what we think about a systematic review, but actually the method document of record for the whole assessment. It's meant to be a standalone document. It does not have to rely on the IRIS handbook. We have one posted now, the chloroform protocol. I think it might be 50-ish, 60 pages. You know, when the IRIS handbook is actually posted, then we might be able to shorten some of those sections because we can point to the IRIS handbook. But it is a standalone document. Comments that we receive on the assessment plan get considered when we're releasing the protocol. So it could be that we have to clarify things, we might adjust the PICO statement. So there is no updated IAP, rather the IAP content becomes the front matter for the protocol. So they roll into each other. And it's released for a 30-day public comment period. So as part of the IRIS process, we obviously want to make sure that we are catching the most relevant studies. And so through the assessment process, it's helpful to share what are the included studies. And so typically what we try to do is in the protocol, and this is in the case for chloroform, is if we've already done screening against the PICO, and for chloroform, there were no major comments on the PICO. So we screened, and then those studies, the included, excluded, are within the protocol. So again, the idea here is to share as early as we can the kind of evidence that we're bringing to bear to the assessment. The protocol is iterative, so knowledge gained during implementation may result in revisions to the protocol. Anybody who does systematic review knows that this is sort of pragmatically how it has to work. Major revisions based on getting into the assessment would be reflected as protocol updates. So for example, as part of the portfolio, sometimes based on the inventories of evidence, you can identify a priori what you think is going to be the most likely, the most useful information. And when we can, you do that and you outline it in the assessment plan. In other cases, you really have to get into it a bit. And as you get into it a bit, what we've realized in terms of making systematic review pragmatic is that if there's evidence that you've identified from screening, that as you understand it, you realize it's really not going to inform the assessment, then you need to have a way of off-ramping it. And that might result in a change to the specific aims. It might result in a change to the PICO. But we have to find a way so that when we, again, identify those areas where we have a choice, we could either keep monitoring a portion of the evidence that is not going to be impactful, or we can off-ramp it. And so a revision to the protocol would be our way to signal to our stakeholders that we've done some tweaking of the PICO and the specific aims. Protocol content, obviously you won't be able to read this, but this is what you're going to be hearing more about over the next day and a half. So again, you would have the updated assessment plan text with the specific aims and PICOs that might have been adjusted based on what we heard from the public. You would have the search strategies, and for chloroform, you would also have the results that we retrieved and how they screened for exclusion or exclusion. Refined evaluation plan if needed. In this case, the chloroform was fairly targeted. There weren't revisions that we felt were needed based on the public comment. Methods for study evaluation, reporting, risk of bias, and sensitivity analysis. So this would be applied in particular to epidemiology and animal toxicology studies. Data extraction. Our approaches for evaluating the quality of PBPK models, that again would be outlined in the protocol. Our strategy for synthesizing within lines of evidence, integrating across lines of evidence, and then again more the dose response assessment. And then also a history of the protocol. In terms of publicly available examples, these should all be part of, I think, the meeting materials that have been provided. Assessment plans that were released in September, chloroform, nitrates, ethylbenzene, uranium just recently released. The chloroform protocol, which includes a list of included studies, was also just recently released. And then we have sort of an example of a rapid systematic review. So this would be an EPA response to a chloroprene request for correction. This has been alluded to in terms of public comment. Last year, EPA received this request for correction to a 2010 IRIS assessment that disagreed with the conclusions. And so part of our response was twofold. One is to consider those comments in light of the peer review that happened at 2010, but we also did a systematic review to try to address the question of whether any data published since that 2010 assessment would be likely to impact the conclusions. And so, so that systematic review, attachment 2, in the EPA response for a question is an example of what a systematic review looks like, recognizing, though, that the specific aims of this one are very targeted. The end game here was, does any of this new evidence likely to alter our 2010 conclusions? But it has, I would say, it has a pretty rich discussion of how we consider the utility and quality of pharmacokinetic models that was included in our response here. We are in the process of trying to release assessment plans and protocols for assessments that are not new starts, that are already in progress. It sort of depends on the maturity of it. You know, when Tina and I came on board, there was an assessment on EBTA and TBA that was well underway. We weren't going to try to sort of obviously do an assessment plan or protocol at that point, but we are trying to roll them out. And this sort of helps us calibrate. You heard Tina refer to that we have this multi-year list of chemicals, and we're trying to sort of reaffirm the agency's need for those. And so you'll be seeing assessment plans on, it's like naphthalene. So naphthalene has been out there. People know that we're working on it. But through this process of developing an assessment plan, we're able to reaffirm the agency's need and perhaps be a little bit more specific about what the need is so that we can better target the scope of the analysis. And then in other cases, arsenic. So arsenic we've been working on for a while. We think that although there's a draft, looking at the draft, we think that we might be able to sort of refine the focus a little bit more compared to what has been shared with the public. So those updates would be sort of a protocol, recognizing in this sense the protocol does not imply that we're starting over with arsenic. It's trying to just be transparent about some of the refinements that we've made to the draft that we've been working on. And I think that is my last slide.
Right. Okay, thanks. It seems like this might be a good break point because I think the materials that follow are not probably coverable usefully in 8 minutes. No. So, and I think in an unusual act of kindness, well, why don't we reconvene at 1 rather than 12:53? So reminded the committee will go back to the boardroom, and I think for the rest of you, I think the major place that you can all go, which will immediately be very crowded, is the refectory at the other end of the building downstairs. Okay, so we'll reconvene sharply at 1. Thanks.